Welcome to Clinicals with Pharm Vic. Today we will be learning about Acamprosate. This medicine is used in the maintenance of abstinence in alcohol dependence. Acamprosate's chemical structure is similar to GABA and taurine, and its mechanism of action is unclear. It possibly involves restoration of normal activity in glutamate and gamma-aminobutyric acid-ergic systems, modulating the balance between neuronal excitation and inhibition. This helps reduce symptoms of protracted withdrawal such as insomnia, anxiety, and restlessness. Now, let's discuss precautions. Renal impairment reduces elimination and increases concentrations of acamprosate. The manufacturer contraindicates use if serum creatinine is greater than 120 micromoles per liter. For moderate renal impairment, a dose of 333 milligrams 3 times daily is recommended, but it's contraindicated in severe renal impairment. Regarding hepatic impairment, the manufacturer contraindicates use in severe cases due to lack of data. However, acamprosate is not metabolized via the liver, making it safe for patients with severe liver disease, unlike other medications. For pregnancy and breastfeeding, there is no data in humans, so avoid use unless potential benefits outweigh risks. Acamprosate may also increase the risk of suicidal thoughts and actions. Patients should be monitored for depression and suicidality. Common adverse effects include rash, diarrhea, and changes in libido. Infrequent effects are nausea, vomiting, abdominal pain, itch, and erythema. Rare effects include urticaria, angioedema, and anaphylactic reactions. The typical adult dosage for acamprosate is 2 333 milligram tablets taken orally 3 times daily. For adults weighing less than 60 kilograms, a reduced dosage of 2 tablets in the morning, 1 at midday, and 1 at night is recommended. Tablets should be swallowed whole. Do not crush or chew them. Acamprosate has minimal drug interactions, and it does not interact with benzodiazepines or other medications used in medical detoxification. It does not alter the central nervous system effects of drinking alcohol or withdrawal symptoms, and it is not effective in the absence of abstinence. Acamprosate has demonstrated efficacy in promoting abstinence from alcohol in several clinical trials. It has been shown to reduce the risk of returning to drinking and increase the cumulative duration of abstinence. However, it does not appear to reduce heavy drinking days, and compliance with medication is important for its effectiveness. This is the end of today's lesson. Share this video, like and subscribe. Let us grow together. Learn, study, and revise.